Coronary Angioplasty. The human heart works tirelessly from the moment it begins beating until the moment it stops. In an average lifespan, the heart beats more than 2.5 billion times without ever pausing to rest. The heart is our very own pumping machine which provides the power needed for us to live. The heart is located in the chest and is positioned almost centrally, with the lower part lying a little towards the left. It is made up of 4 chambers, 2 upper chambers called the atria, 2 lower chambers called the ventricles. Take a look at the right and left atria and ventricles. You know the heart supplies oxygenated blood to all parts of the body. Though the heart is built tough, heart diseases do occur quite commonly. The causes may be lack of exercise, high blood pressure, high cholesterol content, improper diet practices, smoking, etc. One of the most common heart diseases is CAD, coronary artery disease. The coronary arteries are the blood vessels which supply blood. One of the symptoms of CAD is angina, caused by insufficient supply of blood to heart muscles. In angina, pain occurs in the chest and sometimes in shoulders, arms, neck, jaw and back. In such a situation, proper diagnosis is required. Angiography helps in diagnosis and evaluation of cardiovascular problems. The doctor may recommend angiography if the patient has symptoms of CAD like angina. The patient has unexplained, new or increasing chest, jaw, neck, back or arm pain. A heart surgery is planned. The patient has congenital heart disease or congestive heart failure. The patient has heart or blood vessel problems or traumatic chest injuries.